So I'm Wendy Chung. I'm a medical geneticist here at Columbia University in New York, and Volkan Okur, who's going to also be speaking, is another medical geneticist who works with me at Columbia. So Volkan, maybe you can go to the next slide. The purpose for the discussion today is to bring the families up to date. Many of you have participated in a study that I'll be describing, and we wanted to be able to show you the progress we've made, what we've been learning, and importantly, what still some of the gaps are in terms of our knowledge and what our plans are to go forward. And it's also an opportunity for you all to be able to ask some of your questions. Undoubtedly, we'll know some answers, but not all of them. And so it also helps us to set the research agenda to know what gaps there are in our knowledge. So one of the things that you'll be seeing that Volkan's going to be showing is that as a community, we're united in terms of everyone, hopefully, who's listening in terms of having children or family members that have a difference on chromosome 8p. And that's great in terms of being able to have some unifying sort of reason to be together. I think also in terms of the individuals who are collected, there are some commonalities which we're going to be highlighting in terms of some of the common medical or educational or developmental issues, and hopefully being able to learn from each other in terms of strategies, therapies that are working. I also want to underscore, though, that there is some heterogeneity in the community. And I apologize, I'm consciously just realizing I should slow down in my what I'm saying to make sure I know everyone listening, English is not their first language, so I'll slow down. But there are things that unite us and things that bring us together. But as you'll be seeing, there are also some differences. There are differences because of some individuals are younger, some individuals are older, some people are living in different communities, different places in the world that have access to different educational strategies. But there are also some genetic differences, which I think account for some of the variability. And we've done some very careful studies to try and compare those genetic differences, and we'll show you that information today. At the end of the day, I think we're realistic about our goals. Our goals are trying to support individuals with chromosome 8 differences to be able to make their lives full and rich and hopefully healthy. But we realize that in doing so, some of these things can be done in the short term, and other things are really much longer term goals. And so I just want to set the stage that we realize that this is a long-term goal and we are here for the long term. We realize that there are some things that we can do quickly as a community, and I think those are being able to learn from each other in terms of successes and failures. And there are other things that are going to take some real research and really to answer some hard questions about specifically which genes on chromosome 8 are the ones that are more or less of an issue, and to be able to make comparisons across individuals in the group. In particular, if people disagree, I would love to hear about it. But in particular, I think one of the things that's challenging and what we're trying to hope in the near term, or rather in the long term, to help support are neurological differences in the way the brain functions, and to understand which of those genetic differences may play a key role. And importantly, at least my observation as a clinician has been that many of the individuals, especially many of the children early on, I think have a lot more in terms of capacity and capability. I think sometimes the way in which they learn and the way in which they can express themselves may be different. And so I think some of this is a limitation, to be honest, about the people around them in terms of being able to educate them well or in the right manner, and to be able to, for instance, understand the language they're speaking in the way they're speaking it. And so I think there are opportunities for us to immediately compare notes across the community and figure out, as I said, educational strategies that have worked, things to be able to unlock some of what's going on for our family members and our community. And those, I think, are sort of quick wins, if you will, or quicker wins. Next slide. So as we're doing this, I know we've talked to the community before about this, but this is, from my point of view, trying to collect information in something that is relatively straightforward for families. So this is not meant to be an onerous difficult task for you all, but we want to do it in a way that's robust and rigorous, and that your doctors or your providers will trust as we give the information back. And so as we do this, we do ask for your patience, that we collect information in a few different modalities. So one is that many of you have been kind enough to speak with Laura Ham or Volkan Okor, two members of our team at Columbia. We value first and foremost the family's observations. We very much appreciate the insight that those of you have been willing to share with us have shared. So part of what this is based on is a foundation of hearing that directly from you. Some of the nuances, some of the important details can be very, very helpful. So for those of you who have taken the time to do a medical history interview, is what we call it with Laura, thank you, thank you, thank you. It's really been helpful to see that. As you're doing that, I encourage you, Laura tries to leave some, make this as unstructured as possible in the sense of being able to allow for your observations in terms of, as I said, educational strategies or other things, other medicines or other treatments that have been helpful. That's especially important. So I want to emphasize that again. And I realize that sometimes that can change over time. And so that'll be something we'll be coming back to you again, because we want to be able to understand different issues at different stages of life, and or things that have just evolved as different technologies evolve, and new opportunities in terms of treatments or supports. As we've done this, we've also wanted to be able to document some details. So one of them that you've seen us sort of obsess about is on the genetic dimension, being able to make sure that we really are comparing apples to apples and oranges to oranges and pineapples to pineapples. So we wanted to make sure that we got the genetics straight in terms of this. For some of you, your family members were diagnosed many years ago when maybe we weren't using things like chromosome microarray to be able to understand with great precision what the genetic differences were. So many of you have sent in saliva samples, and just to let you know, we've been busy analyzing those, being able to understand what those well-defined, hopefully, chromosome 8 differences were. And that's some of the information we're going to be showing you today and getting back to you as individuals as well. Even beyond that, we're interested in being able to be very, very precise about certain aspects of it neurologically, in terms of how your family member is. And by that, I mean, for instance, being able to look at electroencephalograms or EEGs, to be able to understand seizure or predisposition to seizures, or something that for me is extremely important because that can have a big impact in terms of how the brain is functioning. But there are also other clinical details that in some of your families we've gone back to try and really nail down and make sure that we get them exactly right. And that's because, again, sometimes things can be quite technical. Sometimes things are not even reported to families. They may be discussed with you at a visit, but they may not be discussed in as much detail as sometimes medical records can review. So we're putting all of that together. This grows over time and gets more informative. So just to let you know, this is still a work in progress. But as I think you'll see today, we've made significant progress over not too long that we've been doing this. Next slide, Vulcan. So as we continue going forward, I think Beena Shah may be also alluding to this at the end, but we will be going forward and getting together over the summer. We'll be able to do some other things in more detail, and I really look forward to being able to meet many of you and your children or your family members. To me, that's actually the most joyful part of my job in terms of being involved in this. And as we do it, we're going to be talking in more detail with you about some of these things. So definitely communicate with Beena if you have suggestions or questions that you'd like addressed at the family meeting, and we'll have some more time there. One of the things I wanted to talk about today is that, as you'll be seeing for chromosome 8p, there are some differences between the community, but we're starting to drill down on some things that are the same between many members of the community. And we'd like to be able to have tools, experimental tools, to analyze and understand how the brain is different, how the body is different in your family members. And we don't want to have to do things directly to your children or to your family members who'd like to have animal models to do this, or things that we can do in the laboratory that are less burdensome, hopefully just as precise, but less burdensome, and that some things that we can do in animals that we can't do in people. So to give you an update in terms of some of the things that we've been doing, we have some ideas about the genes that may be involved on chromosome 8, and we have started making, not from necessarily your family members, but we've made these from starting with an individual that had quote unquote a normal chromosome 8, and we've started making our mutations in genes that we think are very important, and made something called induced pluripotential stem cells. So iPSCs is what that's abbreviated as. Those can actually be made into brain cells or neurons in a dish. And rather than having to deal with all of chromosome 8, we're starting to deal with now individual genes within chromosome 8 to better tease apart what are the relevant parts of that that might be driving the differences we're seeing in terms of the brain function and behavior. As we get better at doing that and being more precise about that, one of the next stages is to be able to make mouse models. That's oftentimes recapitulates at least some of the differences, as well as gives us something that's approximately same physiology. So in other words, also a mammal, not something as simple as a fly, which is another model that people use, something that's closer and more related to humans, but also cost effective in terms of being able to do studies that we need to do. With that, the long-term goal is, as I said, beyond just educational treatments and strategies, which we're clearly as a community using now, to be able to understand whether or not there might be medications or perhaps even more farther into the future strategies in terms of gene therapy or gene replacement that might be helpful. And again, those animal models are very critical to think about that, because those are similar in terms of human physiology, similar mammalian physiology, to understand whether or not a drug can get to the brain, whether or not a particular strategy will work in terms of a whole organism. You can't just do that with cells in a dish. So those are some of our long-term strategies. We've made progress in terms of making those reagents. We're not all done yet, and one of the critical issues in terms of making the right reagents is to make sure we know what genes are relevant. So not just all of the genes on chromosome 8 or chromosome 8p, but a specific subset of those genes that are probably driving what we see in terms of the brain. So that's really that issue of being able to tease that apart and identify the relevant genes is a lot of the focus of what we're doing right now. So Vulcan, I think this is about the time we're switching, but let me just make sure.
Oh, yes, that's right. Thank you so much.
Okay, let me just let me pause for 1 second. We're going to switch gears. Vulcan is going to be describing the results that we have from the families who participated in the research so far. But just in terms of the overview or the strategy that we're using, let me just pause for 1 second and see if there are any questions. And I think you can either unmute yourself, or I don't know if we have to unmute you at all. But anyway, feel free to chime in if there are any questions or if there's anything you'd like me to repeat or explain in a different way.
Not right now.
Not right now, I heard. Okay.
Oh, Dr. Chung, sorry, this is Bina. I just wanted to, I see a couple of questions popping up to me personally from a couple of other messenger apps. I think a few of them are wondering if you would require saliva samples eventually from all of the participants, if you would require a fibroblast or skin biopsy from all of the participants eventually.
Yep. So one of the things that we've done, as many of you know, and let me back up a step. For the first step, we've wanted to make this, as I said, as easy on the families as possible. So in terms of, we call it mapping, and you'll see some maps in just a second. In terms of mapping the chromosome 8 differences, we just need a source of DNA for doing that. And the easiest way for the families, we thought, was to be able to get a saliva sample. That's turned out to work quite well. And that's been helpful for the mapping studies that Vulcan's going to, or Dr. Okor is going to be showing you in a second. To be able to make the cell lines that I've been talking about, these induced pluripotential stem cells, if we want them to represent your child and or your family member, we're going to need cells beyond saliva cells. The saliva actually doesn't give us intact cells. For that, we're going to need blood cells or perhaps in some cases skin biopsies. So strategically, what I was waiting to do was wait until the families, some of you will be coming to New York, I hope. And for those that do, that's something that's much easier, I think, for us to arrange when you're on site here. I have a fabulous team of pediatric phlebotomists who are very gentle and very good at getting blood from the children. And if we need to do skin biopsies, I can set it up to do the skin biopsies myself for the families who are in New York. Having those intact cells is critically important to be able to make these induced pluripotential stem cell models. If it were up to me in terms of ease and feasibility, the answer is yes. I would get samples from everyone in the community, everyone with the chromosome 8 difference, and we would have a complete library to be able to do this. Realistically, I realize not all the families will be able to come to New York, and we do have in some countries, some issues in terms of shipping internationally quickly enough so that the cells arrive in time and alive. So the answer to your question is we're going to do the very best we can. One of the things that Dr. Okor is going to show you is that I do think it's critically important for as many families as possible, though, that are willing, and of course I don't want to force anyone to do what they're not comfortable with. You'll see that the children, the individuals are oftentimes different. Not everyone has the exact same chromosome 8 difference. And of course, beyond chromosome 8, we're all different. And so to have your child represented or your family member represented, I do think it's really important that we get as many people represented as possible. There's not going to be just one person who's going to be representative for everyone in the community. So to the extent that it's not overly burdensome, I do think it's going to be good for many people to participate in that. I hope that answered the question.
Yes, that's great. And I just received another question. I think it would be helpful for everyone to hear your answer to this. At what point would you be ready to receive additional scans, such as like multiple EEGs, MRIs, as people continue to get further testing down the line for various symptoms?
Yes. So I think from a logistical point of view, the easiest way for us to do this is going to be to do this as an annual checkup type of thing. And at that time to, get the new information that comes in. If for some reason, and I'd love to hear the family's input on this, if it's easier that as this happens in real time, you reach out to Laura and let her know about this and, give her the newest scan or let her know about the newest EEG. I'm open to suggestions about what's working for the family. The reason we don't do that is because obviously we don't know when you're getting scans, when you're getting new EEGs. So if it's a sort of, the question is, I apologize for those who don't think this way, there's a push and a pull system, right? So there's a way that we can pull something out from you, and that's when we do the annual follow-up. The other way is doing this as a push from you all, where you push information to us. So like I said, the easiest way for us to do this in a systematic way is to do an annual follow-up, but I'd love to hear the community's feedback too.
Okay, great. We'll get back to you on that. I know you don't need an immediate answer.
Right. Yep.
Okay.
So I think perhaps we'll switch gears a second. So I'm going to turn this over. As I said, Vulcan O'Core is a medical geneticist who works here with me at Columbia, and he's going to go over some of the specific details for the family members. And just to remember again, all of this is being recorded, so you don't need to worry about taking notes. You'll have access to all of this after today's meeting.
All right, thank you very much, Dr. Chang. As Dr. Chang said, I'm going to give you an update on the data that we have collected from you and what we did with that data, like how we progressed, etc. So first of all, again, like Dr. Chang said, I would also like to thank you all that you have showed a great interest in our study. And in the last year, we have been contacted by many parents, and we were able to get verbal consent from 113 of you. And we have sent, after we got phone interviews with you explaining the study details, aims, outlooks, we have sent you the printout consent forms to 102 of you, and the other 11 are in the process because we are taking some time when sending out our shipments. And we have got back the signed consent forms from 59 of you, and we have completed almost all of them have been completed by Laura, medical health history interviews and family tree drawings that we gather most of our clinical finding information. And now we are waiting for the remaining 43 as of now. I'm sure because we are now an international study that it's taking some time to get some samples, the shipments that you may have sent your consent forms back to us. They might be on the road. Sometimes there are some mishaps, we are trying to solve those problems. And I will also get back to another aspect why maybe some of those forms have been waiting in your hands. So when we talk with you, we also ask you what kind of genetic tests your kids have got in the past to get the diagnosis of AP deletion or duplication. So we know that 103 kids have been diagnosed by microarray, and 47 of those have both deletion and duplication of 8p, and 27 only have deletion, and 11 only have duplication. And there are 18 other kids I put under the others category here who have an extra abnormality, sometimes on chromosome 4, 7, 12, or other chromosome that you name it. And we also do not have further microarray info for some subset of patients. And we know that especially some older kids, the diagnosis was made by chromosome analysis and a slightly more advanced method like FISH in 10 kids. And as Dr. Chang said, that when necessary, for example, for those 10 individuals, and as well as others, we will perform microarray from the saliva samples that we obtain, and we will further characterize the exact deletion and duplication sizes and coordinates, breakpoints that we name of this 8p anomaly. So what we have done, have been trying to do with these information, especially with the microarray data, to identify the potentially responsible genes for mainly and developmental delay. And here the not the representation, the actual work that I have been working on. On top of the slide, you will see these black and white square bands. Yeah, I'm trying to mouse over here. This is a representation of chromosome 8. We are interested in this upper part, short arm P. And we see here like darker bands and like lighter bands and we numerate those bands like P 23.1, 22, 12, etc. So these are the bands that you see on your kids' genetic test report when you got them. And here, like there are 45, like you can see here, 45 million bases / letters that we call in 8p that like produces genes within this region. There are almost like 450, like and between 500 genes within this 8p region, and we mapped the deletions and duplications onto like this ideogram that we call it here, and like positioned where the deletions, this thinner like green like bars here, and duplications, these dark uh, thicker green bars, like transposes on the actual coordinates. So by doing so, we we were able to see like two things. Mainly, we were able to see what genes are involved in either deleted or duplicated regions. And secondly, we were able to, at least for now, visually compare like different individuals with different deletion and duplication sizes. And as you might see from this visual that many deletions end at like very similar point, and many kids with deletion and duplications, they have similar size of deleted portions, except here, for example, these two. In these two individuals, the duplication extends up to this point. So when we call the most common like deleted or duplicated region as minimum overlapping regions. And here on the left that I tried to outline with this red like squares, a red rectangle, that this is the minimum overlapping region on this screen. But for the deletion size, we are actually interested in the whole, like this deleted region. So, and here for the duplicated part, which I outlined with the blue lines, the minimum overlapping region is here, but as you see, like there are many different patients, which actually may cause the like variety of the problems as well, with different duplication sizes, and which also means that different genes involved. So we will do this, like we will look at this, we will use we are using this like to focus on, to generally globally focus on our deleted regions and duplicated regions, but also we are gonna compare like individuals like separately in a like smaller subsets. For example, here we see on the left part, like when we look at these two individuals here, we can see that like the difference, the only difference is the deletion of this portion and the duplication of this portion. So by comparing the clinical findings of these two patients, we might be able to like guess, estimate, like predict like the roles of the genes here, like when they are deleted, what we see, when they are duplicated, what we see in those individuals. And when we add additional individuals, for example, like this third individual and fifth individual who have normal 8p here, 8p region, and we can also like attribute like some other issues to these duplicated regions, and so on. So we will do one-to-one, 1-to-3, like different permutations of comparisons when we will try to narrow down our candidate responsible genes. And when doing so, in addition to the deletion and duplication individuals, individual deletion cases here represented by red bars, and individual isolated duplication cases represented by blue bars, they will also help us to like piece apart like different clinical findings in those individuals, different individuals. So that's why, as Dr. Chang emphasized again, like many like participant is like so important for us, like to narrow down like our focus like our candidate gene in like regions. So this is what we have been doing so far. This is not all the data that like we have. This is kind of a representation, and we hope that like we will get like more visual like this, and we'll be able to narrow down. So this was the second like action item for the phase 1, and the first one like in the what we accomplished slide is to identify the medical, educational, and neurological challenges and the effective strategies that you have been employing since you got the diagnosis, which will help us like identifying those responsible genes as well. And also will help you, all of us, like to give recommendations when one of our kids has like new challenge, new health issues. Then we will able to ask like another family who may have gone through to the same like stage in their life, like what they use, like how like useful that method was, and then we may be able to recommend that method to your kids as well. So for this, medical history interviews are so important, as I said, and up to date, like we have completed 46, and this is gonna be about all arrangements. I mean, we still do not have enough data on different like arrangements, which I mean like 8p deletion and duplication, or only 8p deletion, or only 8p duplication individuals. So I'm gonna give the global summary of all the patients, but I'm sure most of these findings like will sound similar to you, that you may have like in the course of like your child's like clinical issues. So starting from pregnancy, the most common pregnancy issues were like small size. Like you might be told that this baby is not as big as that you would expect by looking at some charts. And there are like the cardiac problems, heart problems might be detected during pregnancy as a whole, and some brain differences, structural differences, namely agenesis of corpus callosum, might be also detected by ultrasonography during the pregnancy. And when your kids are born, mainly due to the low muscle tone, they usually experience like poor suck, like difficulty latching on like mother's breast, like and feeding difficulties, and like being overly sleepy. And again, still might be related to this neurological low muscle tone issue. They might experience reflux, the backward movement of the like stomach content, and like constipation, and for which I read that like Miralax is like really working very well, which is a really good thing. And many kids like might have like ear infections, mainly ear infections. Normally, like we say, there's like more than that we usually expect from like developing kid. Like it's like a one or like twice at most. It might be normal, like it can be seen an individual without an AP deletion deficient as well. But when it's past like 3 or 4, like it might like point to like some immunological issues as well, and like they might sometimes cause an accumulation of fluid, and which in turn again might cause some like conductive hearing loss. And for when this happens, sometimes like ear tubes might have to be inserted, like to relieve the pressure and like regain the hearing function. And also sometimes like there are like urinary tract infections, which when we say urinary tract, we talk about kidneys, like bladder, and like the urethra. And again, also some kids have like nearsightedness, farsightedness, like astigmatism, and also strabismus. But as we said that we are like mainly focusing on these neurological findings, and when we break down like these neurological neurodevelopmental problems into different types, here we see that hypo and hypertonia, which is low muscle tone, and like stiffness, like increased muscle tone, looks like to be the major problem. Here, like the total number looks 42, but I mean this is kind of a grouping issue. I'm sorry. These two findings might be seen concomitantly in the same kid. It might be like the hypotonia of the body, like the upper body mainly, and the stiffness hypertonia of like arms and legs. So on the left, like we have like 28 hypotonia and 14 hypertonia, and many of them, although they're like individuals with isolated hypotonia or hypotonia, we see both of them in many kids as well. And in 17 kids, we see seizures, and majority of them are absent seizures, which are like staring spells, like kids like locked in on like some blank spaces, and they become like unresponsive to like external, like for example, like if you call them, they might not be able to look back, kind of seizures. For now, like we don't know exactly what type of drugs work or like the best for like what type of seizures, so we can't say anything for now. And 16 kids have either small or large like head. We call it micromegacephaly. And like to be cautious here, this large head might be caused by accumulation of the fluid that is normally flowing within the brain, which is called hydrocephalus. So we need like further measurements, for example, for this, and further like MRI findings, MRI reports to be certain about like the distribution of these problems. And 15 kids seem to have developmental and motor delays, like late age of walking, like crawling, sitting, etc. Fine motor skills, etc. And also speech delays. And in 15, we heard that there are like some cognitive issues, like intellectual problems, speech delay, speech coherence problems, and in some kids also there are like autism diagnosis. And in 4 kids, we have noted walking problems. And to complement this, when we look at the MRI findings of individuals with 8P, we know that there are like 24 MRI have been done so far. And interestingly, in 19 of those 24 MRI, there were at least like one structural abnormalities. And the main abnormality is the agenesis or hypoplasia of corpus callosum. So when I'm saying this is a technical term, I know. The corpus callosum is a bridge between the left and right side of the brain, which is made of a very condensed hyperoptic fibers. Think about like that, and like it transports like the like nerves between the two sides of the like brain, and provides the correlation of the like movements and other functions. So when I said agenesis, it means like absence of the development, or like when I say hypoplasia, it is smaller than the usual size. Like as I said, this might cause some coordination problems and some other issues. And like there are some miscellaneous problems that I grouped in the other category, which do not seem to be consistent in all kids as of now, but we're still keeping in them in watch. And as I said, like in the previous slide, we have read that there are like hydrocephalus in 6 individuals, and small brain and cerebellum in 5 individuals, which might be actually contributing to the walking problems like shuffling gait, wobbling, ataxia, etc. that you may have read in your kids' like reports. And lastly, I also wanted to give an update on these heart findings, because this 8P arrangement, AP deletion duplication syndrome, is also known by the heart problems. And like our findings are also aligning with the literature and other reports. And more than 25 kids have some sort of structural defect, which I mean that there is the heart is a 4 chambers structure, like divided by one vertical and one horizontal wall, and they crosses like in the midline. And when there is a like hole in the vertical line, the muscle structure, like this is called, if it happens in the upper, like between the upper chambers, it is called atrial septal defect. If it is in the bottom one, it's ventricular septal defect. And which is, these two are the most commonly found like defects in our cohort, as well as in other patients reported in the literature and elsewhere. And also like valvular defect, like those valves, like they are placed at the like mouth of these like major arteries that transport the blood from the heart. And the most common one is the pulmonic stenosis. And also like we saw other issues. There is one interesting thing here that I want to like note, that there is one gene that has been like tapped as the main reason of the structural defects, and it is true actually, which is GATA4. But interestingly, in some kids, I can say like close to 10, even though this GATA4 gene is not involved, we see the cardiac defect. So which tells us that there might be another gene or genes out there that is contributing to those heart problems, and we might also be able to identify like this gene in the future. So this is pretty much the summary, that what we have collected so far and what we have done with the data. And what are we planning to do in the future is, now with more data from you, hopefully we will start to break down clinical findings among different arrangements, like 8p deletions, 8p duplications, or when there are only 8p deletions versus 8p deletion duplications. And we will try to see like if there is like any clinical finding that is like coming out like in one group only, or like the majority of the one group. So this will tell us like many things about our candidate gene identification process. And when doing so, again, like your contribution is the most important thing for us to do this. But still, we will try to add other like individuals from other resources, which is first personal literature. We're going to do a literature review, which is like publications out there. And here, though, we want to be sure that we are not going to double count any of the participants in our study. So if any of you have been, like any of your kids' findings and microarray results have been reported in any other publication before, just I would like you to tell us this, and like we will like see, we will like only count you once, so which will help us to make like more clear predictions. And also, in humans, like in like every like genetic organisms, like there are variations, like mutations, or this kind of copy number changes, as we call it, like big size changes can occur without any, let's say, adverse effect, like any consequences, health consequences, which we call like normal carriers. And thankfully, like we have a database for this, and we're gonna fetch the individual's data from that database. So we will also map those like normal carrier duplication or deletions to the 8p, and then we will try to like exclude some regions from the affected individuals' deletions or duplications. And as Dr. Chang said, but while we're doing this, we have also been working on creating the iPS cell lines. And two of our initial candidate genes, CSMD1 and DLGAP2, are ready. And like we are gonna like proceed to the next stage for those genes. And so at this point, what you can do, so as this is like in the second online meeting, I'm sure like there are some new participants that you may, like this might be your first time like hearing from us, like hearing about the study. And if this is so, please send us an email expressing your interest to the below email address. And if you talked with us before but have not got your consent forms yet, again, like we are checking like constantly our records, but if like sometimes like things might have like escaped our notice, please do not hesitate sending us follow-up email. Please do not think that you are bothering us. And if you haven't sent your consent forms, and if this is not because some like shipping issues, logistic issues, and if you have further questions or concerns after you read the consent forms, please again let us know, and we will we will try to like address those issues and answer your questions with all the transparency. We would like to do that. And if you have completed all these processes, please schedule a phone call interview again for medical history and family tree drawing with Laura Ham. And lastly, please continue spreading the word. And this is all from me. And I guess, again, we can switch gears back to Dr. Chang.
So this is Wendy again. So I saw a message that came in on the group chat, and I apologize, Bina, you probably have seen other questions as well, but I just wanted to address this. So a question or a clarification about hypertonia and hypotonia. So that's in terms of the muscle tone being low or things being loose as opposed to being tight and potentially even being spastic. And so in terms of the way that we're collecting data so far, for the most part, it has been by caregiver report. So we are trusting you in terms of knowing your family member best. Hopefully these terms, I know these are medical terms and may be confusing. So definitely, as Laura's talking with you, if you need any clarification, she's glad to clarify what we mean or what you mean by certain things. And we can use terms like loose or tight if it gets confusing, which is which. As I said, within this, there are two other issues. Number one is that things change over time. So things can be different in different parts of the body. And so, at least in my experience, you may have things in terms of trunkal. So in other words, like the chest and the abdomen, the trunk being hypotonic, and sometimes something else like the ankles, for instance, being hypertonic. And so at times, children sometimes need tendon releases, or in terms of physical therapy, we always try and avoid surgery, but physical therapy or Botox injections or other things, and things can change over time. So because we're relatively new at collecting this information, for the most part, we're collecting how are things right now for you. And sometimes it comes up about particular times in the past around birth or other times, but we haven't systematically gone through every day of the life of your child or your family member to know exactly how and when things change. That's a level of granularity that I agree with the point that was made. It's important, and especially in terms of planning for things, this comes up more and more. So I think we're going to get down to levels of nuances of the information. And as I said, as we continue to grow over time and follow your children over time, I think those will become more obvious. The one other point that was made in the comment, which I want to endorse, is that I personally believe, based on what I've observed in many of my own patients, is that there's a lot more going up in terms of what they're understanding, what they're processing in terms of the world around them. And sometimes I think people can be dismissive in terms of not appreciating how much they're understanding, and either just because of some of their motoric limitations or because of some of their speech ability. And so, as I always say to families, be careful what you're saying, because they're absorbing it like a sponge within this. And it is important, the point that was made in terms of not selling anyone short in terms of the cognitive abilities. So I hope that addresses, I think this question came from Corey. I hope this addresses your question. I think I just saw something about a Botox injection question mark. So the question for that, just in case anyone was confused about this, so people may know about, this is the original discovery was botulism toxin is something that actually caused muscle paralysis, and so has been used therapeutically. It comes as an injection, but has been used to actually paralyze certain muscles therapeutically. And so there are some either orthopedists or some rehabilitation medicine doctors that when there are problems in terms of tightness, really severe tightness, that may do that to try and relax a muscle. It's not completely permanent forever, but it's semi-permanent in terms of months that it has this effect. So we don't do it lightly, and certainly we would always start with physical therapy, but it is something that sometimes we consider when we realize that tightness is a problem, and to try and avoid long-term surgical interventions. So I hope that answered the questions that I saw online. So we'll open the floor up to any other questions if folks want to. I think everyone is able to unmute themselves just by toggling online, or if there's anything that comes in that you want to put into the group chat, or Bina, if there's anything you're seeing privately, we're glad to answer questions.
There's one question about intellectual disabilities.
Okay.
It is saying that in one slide, it says like 15 subjects had intellectual disabilities. I believe that was out of 47 subjects. Does it mean 32 did not have intellectual disabilities? At this point, we cannot say that. Yes, like that is like what we were told directly, like as having intellectual disability. So there might still be other kids with problems, or they might be really very young now, like to assess like these domains. So we cannot give an exact like ratio or like trajectory for this.
This is Wendy Chung. Let me just amplify what Dr. Okor was saying just to make sure it's clear. So in children, we don't give a diagnosis of intellectual disability until they're old enough to know that that's a permanent thing. We sometimes use the term developmental delay when they're younger. And so for some individuals, they haven't yet gotten to an age where an intellectual disability diagnosis is appropriate. What I would say is universally, we've seen across all of the children that there's some degree of neurodevelopmental disability. I don't know of anyone who hasn't had at least some issues. And over time, one of the things we will try and get very precise data from you, if you have it, is information about exactly if an IQ test has been performed and what that IQ number is, because that's the most reliable and quantitative measure we can get. I will warn you that the IQ measurements that psychologists make are oftentimes not perfect, though. And for individuals who may have problems with attending or focusing, or problems, individuals who are nonverbal, again, I think the way our current IQ tests are structured, they may underestimate really what cognitive capacity is. So I wouldn't put, don't overly emphasize an IQ if your child has had an IQ measurement. Let's see, I saw a couple of questions here. I think I saw an endorsement that a child may be nonverbal, and I think the question is, but they're totally understanding, which, like I said, I've seen myself. How do I express that to everyone else? I think if the question is, in terms of other educators or other family members or things like that, there are. I'm not sure where you are or how old your child is. This is one of the things we can get into at the family meeting, but there are increasingly better communication assistance devices. And that's one way that I've seen literally speech sort of blossom or communication blossom. So just very briefly, depending on the age and what technology you have available, this is something we can talk about more at the family meeting or a future WebEx potentially. I see a question, is there any connection with low muscle tone and the absence of speech or speech delay in the children? My dad, who's a speech pathologist, did not believe it's possible. I'm wondering if you know anything about this. So one thing I'll say is that, let me see, and I see another question about the nonverbal comes from the brain or the muscle tone. So I think when we think about this, I think of this as being really centrally or focused in the brain. So this is what I would call a central hypotonia. I don't think there's a problem for the most part with the muscles themselves. It's the signal going from the brain down to the muscle in terms of setting that muscle tone. I think that's the fundamental thing. To the extent that chromosome 8 is affecting the brain, and the brain is also affecting the mouth and affecting the ability to coordinate very, very specific mouth movements, I think that's where the expressive language becomes an issue. Some of you may have noticed, though, that your children also have oral hypotonia, so the muscle tone in the mouth is also low. Some of the ways that we can see that sometimes is if the mouth is open, excessively, or if there's drooling or saliva coming out of the mouth. That's one of the things we can see that tells us that's an issue. With your speech pathologist, they're often working in terms of exercises to build the strength of the muscle in the mouth, as well as to help the coordination. But coordinating speech is a very, very complicated task, and it takes a while. So number one is don't give up. Continue to work with your speech pathologist in doing this. At the same time, and I know not all speech pathologists will agree with me, but some of you have heard me say that I think it's very important to also have other methods of communication besides the words coming out of the mouth. I don't give up on the words coming out of the mouth. I continue to reinforce the use of words, but I do think there are some other, especially assisted communication devices that are very, very effective.
Dr. Chung, this is Bina.
Yes.
With the interest of time, I know you have a hard stop right now, so I wanted to just let the families know that they can stay online, and if Dr. Okor and Laura could just stay on for a few more minutes, we could probably compile the questions, and then I can organize them and see if we can do it, through the internet or electronically, and kind of post some responses for the benefit of all the families, even those that couldn't attend. Just for clarification, I wanted to suggest that when some of the slides were presented representing deletion and duplication patients, that I think the commonly accepted description also implies that they would have an inversion. So for those that are curious where you fell in that kind of count, if you have an inversion, deletion, duplication, it's basically the same as what you've seen on the slides as deletion and duplication.
I'm afraid I'm going to have to sign off, but it's really been great to see folks and to hear from you. And as Bina said, Laura and Vulcan will be staying on the line, and I'm glad to take questions if we can't address them all right now. But it's been really great to see everyone, and I hope I'll get to see some of you in New York.
Thank
Bye.
you. Bye.
Bye.
So I don't know, Laura, is this okay? Just putting you on the spot right here, but as some of the families ask questions, if you could jot them down.
Sure.
Perhaps. Mm-hmm. Okay, we'll just keep kind of an aggregate list together.
Sounds great.
I am reading quite a bit on communication, so I think what I have a couple of ideas in mind to address that besides Dr. Chung. I think it might be nice to just collect some information And I can do that through the Facebook group as well. And it wouldn't be as formal, but perhaps we can just start a separate post on that, on speech communication devices. I think with my daughter Karina, we have a really great team here in New York with a variety of oral motor speech specialists, all with their subspecialties. So I'm happy to elaborate what we're doing for her here and some of the things that we've seen that have worked, that have not worked. And so I'm very curious to share that with all of you and hear back on speech and communication. I think there was a couple of questions regarding the upcoming, what I'm calling as the first Project AP Scientific and Family Conference. So that is set in stone for June, hosted at Columbia University, Columbia Medical Center in New York City. I did post that as an event on the Facebook group. I will put that on the public AP page, as well as once we have a draft agenda, and post that on the projectap.org website. Just preliminary, and I just actually had a call this morning with Dr. Chung on this topic, is to either start June 27th evening as a very casual dinner get-together, Thursday evening for those that are arriving into New York. And once again, it would be casual for any clinicians. We'll try to have various, what we're calling therapies, but I know on the industry side, they use a different term, but what I mean by that is PT, speech, OT, possibly, some medical specialists, ideally a neurologist, cardiologist, and we're aggregating a list of invitees, and just really be a very informal meet and greet so we can all get to know each other. And then Friday, June 28th morning, start with the check-in, breakfast, various presentations, including presentations by Dr. Chung, and give you all the opportunity to schedule some one-to-one sessions with a variety of the specialists. We'll have some brainstorming sessions. So Friday will be a full day. Saturday we'll continue with some breakout sessions as well. And, I'm just kind of giving you a bird's eye view of what we envision for the conference. There's certainly more specific details that I'd love to share with you, but it's a work in progress right now. And the more information that I aggregate and finalize, I'm happy. But those are really the dates, June 28th and June 29th. June 30th is a Sunday, and that is not officially part of the Project AP conference, but I certainly will be available, and we can come up with some really fun activities together. All the families can be on their own and really enjoy Manhattan.
Can you hear me?
Yeah. Hi, Jessica.
Hi. Well, this sounds great about New York. So as I understand, the dates are now final. So we can now chase the and the accommodation. Is that correct?
I didn't hear you clearly. All I heard was the dates are finalized and the accommodation. Everything in the middle I didn't catch. I'm sorry.
Yeah. Yes. I asked if these dates are now fixed and if it's okay for us to start to find tickets for New York.
Yes, it is. There's a couple of announcements that we will be making to officially have like a registration link. And also we are working on finding a group discounted rate for the hotel accommodations. So give me about 2 weeks to give you guys a better idea on pricing so that you can kind of think about your total family cost for this trip. I really want to provide that to you so there's not it leaves less guesswork. But again, I'm happy to talk to you one-on-one. So if you are comfortable enough, you can send me a Facebook message, shoot me an email. My email is info@project8p.org. It's also on the contact us part of the website. I think it's kind of everywhere, but you know, I'm pretty hands-on. So if anyone that has sent me a message, I usually reply within 24 hours, and I can schedule a quick 20-minute call with you and answer those questions.
Okay, we'll be in touch.
Thanks.
Also, I would like to ask regarding those special analysis that we sent saliva. It was said in the beginning of this today's meeting that maybe some individual dialogue can be possible. But Dr. Chunk already left, maybe with Dr. Kaur, or maybe we can arrange some other date about that.
Yes, I'm here. We can talk about this. This is Milanovic. We got
yes,
the results.
But I'm not sure if everybody else would like to listen this.
No, another time.
Another time?
Yeah, you can email me and Laura.
Okay.
And like we got results for the like first set of samples.
Okay.
So yeah, we can give.
Okay, I will send email to Laura, and we will arrange this privately.
Yeah.
Individually.
Yes. Yeah.
Okay. Thank you.
You're welcome.
Laura and Dr. Kaur, would you like to say anything about, I guess, generally the expectation or some sort of time frame when you expect to receive the medical consents that you sent out but have not received signed back, or even there's been some logistic questions about FedEx costs and things like that. So if you could just address that in a general way to help everyone.
Yeah, sure. I think Laura is the best to answer this.
Hi there. So, there have been forms sent out over the last several months. Some of them we already have back, and so thank you for that. I understand that other folks have had issues getting it back to FedEx, for instance, and so we've arranged some remote pickup requests. Basically, we want to be as helpful as we can in terms of answering any questions you have on the consent forms and any questions about getting them back as well. So I would say, we're eager to keep things moving along. If you happen to have them at home and have been putting it off, then we would love to get them soon. But we're also understanding of the things that may come between sending them off. If there are any questions that we can answer in the meantime, just to ease any doubts that you may have on the study, or help you kind of hold your hand along the way to get it back to us, if that's what it takes, we are definitely happy to do so. So be in touch with specific questions that you have.
Okay, it seems like there are no other questions. I'm making a note of all the questions on the chat. So for some specifics, we will definitely aggregate some of those, and we can use the Facebook forum to be able to answer them. And I'll certainly reach out with Laura and Dr. Kaur and Dr. Chung to make sure that they have reviewed and we all work together on some of those responses.
It sounds good.
Yes. Yeah, thank you.
Okay, there's one more question. Is Daniel Salver is asking if 8P is always de novo. No, not always. Sometimes it can be inherited from one parent. And there's this notion actually where the name of inverted deletion duplication is coming from. One of the parents carries an inversion within the 8p region, which creates some instability when the cell is dividing. So that might also cause the deletion and duplication of the affected region. So for now, by looking at those microarray results, we cannot say anything. For example, I remember I heard something about that like these deletions are directly inverted deletion duplication. But as a notion, they are accepted as inverted deletion duplication syndrome. Yes. I hope this answered the question without being so too complicated.
Yeah, and I can just add to that. I mean, just from the Facebook group, I know that there are definitely some circumstances where one of the parents has 8p, and so does one of their children. So there are definitely a few cases out there, and I can't quantify them, but I know them qualitatively. A few cases out there that are inherited, and not just de novo. And we're certainly, I'm sure that Dr. Okor's team is using that as vital information as they proceed with analyzing the findings from all the information that we're providing to them. So thank you for that. And I think I would encourage that, as you find more relevant information, you've done a recent MRI, to share that with Laura and Dr. Okor as well, so they can update some of these slides. I will also share with all of you that I have a lot of similar questions. For example, I know with some of those bar charts, like to see only 15 with developmental delays out of a field of 46, I'm surprised. I would presume that majority of them have developmental delays. So, what I'll do is I have a list of questions on some of those specifics as well, and then I can relay my questions and the responses that I get from their team as well, and share that with all of you.